I'm Stephen Blythe. Most of my patients, like most uninsured Americans, are either working people or they're people who have recently lost their jobs in this bad economy. Many of them find themselves without health insurance for the first time in their life. What really bothers me is that most of these folks can pay for basic health services, but they get ripped off every step of the way. They're charged 3 to 10 times the Medicare rate, for example, for most healthcare services and procedures. One of our local hospitals, for example, charges $3,000 for a CAT scan. The same CAT scan they collect $650 for from insurance companies or $450 from Medicare. And in fact, I can call around and find the patient a CAT scan for $450. Our hospital charges $100 for a blood count. I can get them a blood count for $5. And our local hospital, if you're an inpatient or in the ER, and if you have an EKG, the charge is $332. This is the same EKG that I get paid $28 for doing in my office. It's absurd that the patients who can least afford it get ripped off so much. And if you don't have insurance and you need that little purple pill, you go to the drugstore and you pay $160 for 30 of them. Your friend with insurance, on the other hand, will pay a $30 copayment, and their insurance company will get a $50 or $60 kickback every month. Nowhere else in healthcare are kickbacks legal or considered ethical, but this is one way that the drug companies can artificially keep the prices high for people without insurance. This is absurd. This is why I wrote the book, Uninsured in America. I attempt to explain how this happens, when it happens, and to help people understand how they can avoid this ripoff, at least whenever possible. Last year I ran for Congress. Part of my platform was the Uninsured Americans Protection Act. It would have required all providers of healthcare services to list publicly their costs, their charges for each service and procedure that they offer, and right next to that, what they accept from Medicare for the same service and procedure. This would pretty much bring the prices down for those who pay cash. Additionally, it would have required that any patient who is an inpatient or in the emergency room in any hospital that accepts federal funds could not be charged more than 20% above the Medicare fees for the same services and procedures. Again, this would make sure that those who are most vulnerable are not ripped off by our healthcare system. We need changes, we need reforms. I don't see it happening a whole lot in the near future. That's why I wrote my book, Uninsured in America, trying to keep people from being ripped off while they get the health care they need. Thank you very much.